Welcome to this first Stride workshop of 2021, part of our Staying In Together programme at Positive East. My name is Greg.leonard and I'm a peer support officer at Positive East. I work with providing emotional support to our clients, and I'm often the first contact that they have with us, so I get to see firsthand the problems that people living with HIV are experiencing during this lockdown. We've seen a spike in clients seeking access to this and many other services. And to accommodate this increase in demand, we trained 10 new mentors in November last year to join our existing team to help combat the distressing effects of prolonged isolation. If you'd like to talk about emotional support or any other support, please get in touch with me or any one of us here at Positive East. Help is here if you need it. We welcome live comments and questions, which you can ask live via the comments section of this broadcast. And if you'd like to give us some feedback on this presentation for any of us afterwards, please forward them to me and I'll see that they reach the right person. So tonight I'm joined with Massimo Nardi and Marc Thompson, and we'll be looking at sex, relationships and COVID. We've seen a significant change in the needs of our service users in all areas of support since the pandemic began almost a year ago. Changes in attitudes are changing as we move through the pandemic, and we now see light at the end of the tunnel. For so long we've been required to stay at home, protect the NHS and save lives, which for some of us is easier said than done. We're getting lonely, isolated and insular, and to so many of us, social distancing is a difficult challenge to meet. The allure of dating apps like Grindr is often too strong to resist, and we're starting to go out and have sex more and more as society becomes more complacent in following COVID rules, which mirrors the change in behaviour in society in general, according to Priti Patel's public address yesterday. We also see the frustration on Facebook and other social media at those who don't follow the rules of social distancing, which is understandable. But it's also understandable that there are some of us who will still need men for sex to alleviate the sometimes crushing side effects of loneliness. If you choose to have sex, we're here tonight just to inform you how to do it as safely as you can. We appreciate this is a public broadcast, but there's no room for stigma and shame at Positive East. So please be mindful of people's feelings so that we can get down to the business of supporting people with HIV and helping them live happy, healthy lives. We've noticed a considerable increase in inquiries about sexual health. The prospect of a vaccine is changing attitudes, and although we're aware that we should be following government rules on social distancing, some of us are still meeting guys and having sex. We're going to be talking about the issues and concerns that casual sex during COVID presents and what we can do to stay safe throughout the pandemic. Our prevention and testing officer here at Positive East, Massimo Nardi, will be telling us about Positive East sexual health services and how they've adapted to continue providing world-class support for our clients over the last year, and how you can access our services safely if you have any concerns about sex and relationships or anything else for that matter. First of all, I'd like to bring in our first guest speaker tonight, Marc Thompson. Marc's dedicated 25 years of his life working in the HIV field, and he's an influential figure on the London HIV scene. And he's worked for HIV support organisations such as THT and Positively UK, where he's been instrumental in how the face of HIV services look today. He's worked in health promotion, public health and social justice movements, which focused on Black and queer communities, sexual health and HIV. He's the co-founder of PrEPster Info and Blackout UK, and he's currently director of the Love Tank, a not-for-profit community interest community that promotes health and well-being of underserved communities through education, capacity building, and the research, and his research. And he's with us this evening. Marc, it's great to have you with us.
Hey, Greg. Hey, everybody.
I'm very well. It's good to see you, mate. What have you been doing since the last time we met?
Well, I mean, I've been trying, like everybody else, to kind of deal with this latest round of lockdown 3, the sequel. And it's been a challenge, you know. I was bubbling along, okay, and then boom, we're back indoors. And so I've had to find ways to manage that myself by connecting with my work colleagues and my friends and family as much as I can. And I've been incredibly busy with our work at PrEPster and the Love Tank, producing lots of information, developing new projects and working on some amazing stuff, which folks will be seeing in the spring and the summer of this year. But it's really lovely to be here with you all this evening. I love Pos East and working with you guys. So I'm really looking forward to tonight's conversation.
Me too, and Positive East loves you, Marc, as well, you know. Just before we start, I sent out flyers for this event and I received an email from one of our service users and I'm sure that it echoes many people's views on having casual sex in the current climate. Can I read it out to you if that's okay?
Yeah, sure. Please do.
It starts off, seriously, Greg, meeting guys for hookups, illegal. I just watched a friend of mine die of this rank stupidity. The advice is simple, don't. There is no hookup safe sex. Not sure. Here's nearly 2 million other reasons not to. Please do the right thing. Your comments?
Yeah, I mean, thank you for reading it out, for sharing it. And I completely hear the person's concerns and worries around that. And they're right. You know, these are really dangerous, scary, challenging times for all of this. And we are all in this together. There is no escaping that. And whilst I'm not here and PrEPster and Positive East aren't here encouraging casual sex or casual hookups, we can't escape the reality that people are still going out and meeting up and having sex for a plethora of reasons, which we'll talk about in a minute. But my job and our job is to try to give people the right information to make informed choices, to make healthy choices for themselves. And if that choice is abstinence, then absolutely. But if that choice is to have sex, be that casual or with a regular partner, our role is to give people information so they can do that safely. So I just think, I mean, we spoke a little while ago, and when I hear that, I reflect on the earlier days of the HIV epidemic in the 1980s and 90s, where very often the message to gay and bisexual men was don't have sex and use condoms all the time. And we know that those messaging doesn't work. We know that telling people just to stop smoking or just to exercise doesn't work. So we need to meet people where they are and give them the information that they need so they can make the choices for themselves. And hopefully tonight, when I'm talking, we look at it in that context. So just to repeat, I'm not here to encourage or tell people to go out and have casual sex. What I'm here to do is to inform people, if you are, these are the safe ways, and these are the ways that you can avoid it.
Mark, thanks for clarifying that. It's some very valid points that you raised there. So we've asked you to come along tonight to tell us how we can stay safe if we're going to have sex during the COVID, what we can do to look after ourselves. What have you got for us?
Well, first of all, I mean, I kind of want to put out there, I mean, I'm a positive man as well, and I live with HIV, so I completely get many of the issues that our community will face. And also, I think it's important for me to say that some of us are older. Our population of people living with HIV is older, so some of the issues around loneliness and isolation we've been experiencing for a really long time. Somebody asked me, how am I coping with lockdown? And I said, I'm a 51-year-old black gay man with HIV. Social isolation is nothing new. But COVID has definitely exacerbated that loneliness and that isolation that we may all be feeling. And what we do know is that during lockdown, this may lead us to do things which will lift those feelings of loneliness and isolation. Now, some of those things might be really healthy, like exercising, going for walks, connecting with our friends and family, taking part in conversations like Positive East are doing, right? So I think those are really, really good things. But sometimes lockdown may lead us to doing unhealthier things. So we may drink more, we may take more drugs if we use drugs, we may smoke more, we may eat more. I know that I've eaten a lot more over the past few months, but that may also lead us into making decisions which are not as healthy for us around the sex that we might have and how we engage and how we find that sex. And that might be getting onto the apps and looking for hookups. It may be meeting up with fuck buddies. So these are all of the things that we might do. And what I want to do is to try to make sure that people can know what they can and they can't do. So at PrEPster, and I think that we'll pop it in the chat, you should definitely visit our website, PrEPster.info. And we've got a couple of pages there, one which is our COVID hub. So we've got probably about 27 tips and tools that you can use, everything from getting your meds to looking after your friends to volunteering to domestic violence. So definitely check that out. And then we've got a special section which is just around COVID and sex. And we've created a number of tips which I'm going to talk about in a minute. But I think there's a couple of things that I want to point out first of all, is that government guidance is very, very clear that we should stay home, that we should follow precautions like washing our hands as regularly as possible, and we should maintain social distancing, and we should wear masks when we're out in public. So I think those are things which we need to constantly reiterate. I think it's really, really important to remember that COVID cannot be transmitted via, COVID can only be transmitted via close person-to-person contact during sex, but COVID itself isn't sexually transmitted. There's no evidence that COVID has been transmitted via pre-cum, cum, vaginal fluids, or rimming. But the close personal contact, so coughing, sneezing, and all the rest of it that we know, these are things, and we know that when we're having sex and we're being intimate, that these are things whereby COVID can be transmitted. So the tips and tools that we came up with are kind of fun, but we think they're based in reality. But the first one is probably the most important. Have less hookups. Meet with less people. The less people that we meet with, the less chance there is of passing on COVID. And government guidance very recently is constantly to reduce the number of people that we are engaging with. So we're in regular times, somebody might have gone onto Grindr and hooked up with one person and another person, another person. We're saying don't do that, because that just completely increases your risk. In fact, one should avoid casual hookups, period. But if you are going to go on Grindr, if you are feeling lonely and you are feeling isolated, then we would say definitely reduce the numbers of people that you are having sex with. There have been reports in the press of sex parties taking place. I think many of us would have heard about the Hungarian minister who jumped out of a window to escape a sex party. Poor man. But these are the things that we should definitely not be engaging in. We should not be going to sex parties. We should not be having multiple partners. So I think that's one, less hookups. The second one seems pretty obvious, but it may not be obvious to some people, because you may just think, well, I can dodge this bullet. And that would be hold out if you are feeling unwell. So hopefully viewers will know what the symptoms of COVID are: consistent dry cough, fever, etc. And you can find out all that information on the government website. But if you are feeling unwell at all, in the same way they say don't go into shops or self-isolate, if you are feeling unwell, hold out. Do not have sex. Do not connect with people. Now, I know that may be really difficult, but this is when one might be really highly infectious. Now, we do know that the evidence is demonstrating that many people could be asymptomatic, which means they have no symptoms of COVID. Very similar to HIV. You can have a HIV infection and have no symptoms and still be infectious if you're not on treatment and undetectable. So if you're asymptomatic, you can get tested now, but if you are feeling any symptoms, we would say that not to hook up at all. The next tip that we've got, we've called it stay on top form. Look after yourselves. So the first thing for those of us that are living with HIV that are tuning in today is to make sure that you are stocked up on your HIV medication. It's absolutely important that you're not running out of your pills. Now, we know that NHS services have been impacted greatly, and so have sexual health and HIV services. And Massimo is going to talk in a moment around testing and screening. So we still can get tested. But as a POS man myself, I was able to get a repeat prescription of my medication with my clinician recently. So I would definitely make sure you've got your meds. If it's been a while since you've had your viral load test and you're concerned about your undetectability, then get an appointment. You can still see your HIV clinic. It may not be immediately. There will be certain measures which are put in place when you attend the clinic, but you can still get that done to reassure yourself you are still undetectable. And if you can't get a clinic, please, please, please adhere to your medication. Take it as regularly as you can do. I know that in these uncertain times where we're feeling insecure and we're feeling unsure, we may think that's the last thing we want to do. But please, please, please stay on top of your HIV meds. The third thing within the stay on top form is get tested and screened. So people may still be hooking up, and if you've not had a sexual health screen for a while, now is a really good time to do so. So Massimo is going to talk about how PrEPster are doing that, but you can also order free test kits online, and we'll pop that into the conversation, into the comments as well, where you can get home testing kits. So it's really, really important. So I'll reiterate those 3 points. 1, make sure that you have enough HIV medication and you got a stock for the period of lockdown. 2, make sure that if you need to get a viral load test or CD4 count, you get that with your HIV clinic. And 3, now is a really good time to get STI tests and screens. You should really, really get it done. I've had a couple during the lockdown and it was really easy, really simple, and I felt really reassured once I'd had that done. So the next one we've got is a bit of fun, because those are all serious. Get kinky, get creative. So we don't necessarily have to go and hook up with other people. Why not hook up with yourself? Is this time to invest in some new toys? Is this a time to discover different parts of your body, how you like to play with yourself? Set yourself a nice bath, get your favorite lubes, put on your favorite porn, or even discover some new porn. What's out there that you've never seen before that you want to engage in? Last week, you know what I did? I went and I discovered all of my own old porn magazines from 1984 to 1997. And it was like revisiting old friends. So that for me was a way of getting really, really creative. Now, you may not have old porn magazines like me, but there's loads of stuff that we can discover. And I think now is a time to get in tune with your body, to rediscover your body, to rediscover what gives you pleasure personally. And you can do that on your own. So nip out, get online, get yourself some toys. I found a remote control one. So you can even get a remote control toy and give it to your partner, and they can control it from, the other side of London if you want. So I would definitely get creative and get kinky. And then the final tip that we've got, excuse me, is virtual sex. Now, we are probably all zoomed out. And the last thing you want to do is jump on Zoom with your sexual partners, excuse me, and as my friends say, knock one out. But hey, at a distance, why not? So use WhatsApp, use Zoom, use all of these different methods. And actually, if you're on Grindr, swap pics with each other. You might not have to hook up. You can have phone sex. Those of us old enough remember telephone lines. So get kinky, get creative, have that virtual distance. And, this is all about pleasure and self-care and looking after ourselves. And I think that whilst COVID and the lockdowns have definitely put a lid on what we can do, I think as we've seen through our work, it's also opened doors and opportunities for us to explore new and exciting things that we may never have considered before. So just to wrap up on all of that, I want to kind of just circle right back. And I know that we as a community are disproportionately affected by loneliness and isolation and poor mental health. And COVID doesn't take away our horniness. It doesn't take away any of those things. But this is a time for us to connect with people. And that may not be through sex. And we can find intimacy in so many other ways. So again, stay home, stay safe. I accept and acknowledge that abstinence and not having sex right now is probably the right thing with casual partners. But I also acknowledge it's not always easy for all of us. So visit our website at PrEPster.info. Check out those useful tips and tools. If you've got any questions or comments, pop them in the chat and we'll discuss them. And if you've got any more comments and queries, pop us a line at hello@PrEPster.info, and we're more than happy to have a chat and tell you what we think about sex during COVID. Thanks very much, Greg.
Well, that was fantastic. That was really enlightening, some really useful information, definitely some ideas that I will definitely give some serious due thought. I've got a couple of questions, if I may, Mark. Sometimes I've heard people say that sex is okay as long as you don't kiss each other. Is that any truth in that?
Well, I think that what we need to look at is that we know that COVID can be passed through really, really close contact. So I would say that kissing may be unsafe, maybe difficult for people to do. So I would avoid that in close contact as well. We talk on our site about using masks during sex for a bit of fun.
Good idea. You mentioned home testing kits earlier on, Mark. Can you just clarify what STIs can be tested at home?
Yeah, absolutely. So from SH London, you can get gonorrhea, chlamydia, and syphilis done. And I think there are some places, Massimo, you might be able to tell me more about this, will also offer online HIV testing as well. But definitely gonorrhea, chlamydia, and syphilis, the 3 most common STIs.
Great, thank you very much. That was a fantastic talk, Mark. Thank you so much.
My pleasure.
All right, moving on. We're going to bring in our next guest, Massimo Nardi. Massimo is the much-loved colleague and prevention and testing officer with us at Positive East. Massimo, great to have you with us. Good evening.
Hi, good evening, everybody. Yes, as Mark and Greg were saying, there is this difficulty in getting like HIV and STI tests as well due to the lockdown and having necessity to self-isolate, and a lot of clinics also having reduced personnel because of redeployment for COVID reasons. So having an STI screening or an HIV test can be quite challenging in this period.
Before we go into the nitty-gritty of how we access tests, we just want to know a little bit about you. Of course, you're a well-known figure at Positive East, and you do a lot of great work for us right across London, but also East London. But some people won't know you are. Can you tell us a bit about your background and what your job role involves?
Well, I started being interested in HIV prevention more than 5 years ago. I was a volunteer with PrEPster in West London, PhD, and GMI for the Pan-London MSM program. And then I got really passionate with this world and started working with PrEPster first, and then for the last 2 years I've been here at Positive East, and I've been loving it. So that's what I do.
Thank you. Can you tell us about your role in Positive East and how you developed and grown the service to meet the challenges that HIV prevention and testing presents in a COVID world?
Sure. So basically my role at the moment is, since we don't have any face-to-face work for obvious reasons, all our work has been in the past months to devise a way to help people who want to get tested, who need to get tested, and can't access a face-to-face test. We know that SHL provides this fantastic like service where you can get your HIV or your HIV and STI screening directly to your home. But we also acknowledge that a lot of people doesn't feel comfortable in using this kit on their own. We get a lot of people saying, oh, I don't know if I'm able to prick my finger on my own. I don't know if I'm doing it right. And so we try to find a way to help this part of the population. And we came out with the idea of coaching people to use their own STI or HIV test. So it's as simple as that. We send them the kits that are very similar to the SHL kits, and we also provide like rapid HIV tests from BioSure, which can give the results straight away. And at the moment that we send out the kit, we also give them a video appointment so that when they receive their kit, they can connect with us, and on video, we explain to them how to use the lancets, to prick their fingers, how to take the sample for the HIV test, how to take a larger sample of blood, which is quite challenging for some, for the syphilis and hepatitis screening. And also, apart from that, we also provide some emotional support, like sometimes people is anxious because they think they had like dangerous kind of sex, so they are really anxious about it. And it's also our role to make them feel more at ease and ease a little bit of that anxiety that can also impact in the way that you are doing your test, because if you're anxious, it's kind of difficult to deal with this kind of situations. And important also is that we provide afterwards, especially with the HIV test that gives the results straight away, we provide a way to help manage the results there and then, so they don't have to deal with the results on their own. We are there explaining to them what will happen next, because a lot of times anxiety comes out of not knowing what is going to happen. So I noticed that already when you explain them, look, now you will have an appointment at the clinic. They will do a confirmation test, and you will go through this process, and they feel like relieved because they know that what is going to happen, reverse from like taking your test and you get a positive result and you don't know what you're doing next. So I think that's the value in the service that we are providing. And also for the STI screening, it's important to have explanations as well. For example, when I have a lot of questions about the hepatitis B result, because when they give a result about hepatitis B from SHL, you get something like hepatitis B antibodies not detected. And a lot of people is going like, and what does that mean? So you explain to them that Hep B has a vaccine. So if you don't have antibodies in your body, probably you haven't been vaccinated. And you can, if you ask for it, to your sexual health clinic. And we can also provide condoms as well. We have this, we have established this new service with Freedoms, where all the categories that don't fall into, like, for example, C cards for under 25 that can get condoms sent to themselves for free, or men that have sex with men that can go to the Freedom site and order condoms for free. There is a large part of the population that is left out of these schemes, and they don't have a way to get condoms for themselves for free. And we know how condoms are very expensive to find. And we have also a lot of connections with the clinics. So we can also help out with some issues like finding PrEP in East London. So if you try.
Can you just, for those who don't know what PrEP is, can you just tell us a little bit about
Yes, sure.
what it is?
So PrEP is a medicine, basically. It's a blue pill that you can take in different ways, and Marc is much more an expert on this, but you can take it in different ways. Most of the times people take it every day, and it helps reducing to zero the transmission of HIV if if the medication is taken regularly. So it's a game changer on the fight against transmission of HIV, because as many studies say, it's a pill that is almost 100% effective. I would rather say like 100% effective, because up to now, there are very few cases where it didn't work, and most of them are explained in a way that it's not a PrEP that is not working, but there is something else behind. To say it like in a in a short way. And so it's important for many people who are not able to protect themselves in other ways, and it's also the most effective way, because if we think about it, it can be even safer than using condoms to avoid HIV. So it's really important for the prevention of HIV to have this possibility. And we can refer anybody to East London clinics for PrEP. And of course, in these times with this restriction of personnel, it will be a little bit more of a wait to get in contact with the clinics, but there is this concrete possibility of being able to have a help from us to get hold of PrEP.
Thanks. Can I just bring you back in again, please, Mark?
Yeah, sure.
If people, that sounds really interesting. What Massimo was talking about, basically, it's a tablet that we can take which stops us contracting HIV. How do we access that during COVID?
Well, I mean, you can still get it. I mean, PrEP is now available on the NHS in England, and you can get it from your clinic. So I would suggest that people who want PrEP, they can visit our website, or they can visit I Want PrEP Now or THT, and then they will find, or just get in touch with their clinic. I know that Dean Street, for example, in central London, are really, really pushing PrEP at the moment. So get in touch with your clinic, and you should be able to get a prescription of PrEP. But again, as we know, and as we've said a few times, the pressures on the NHS are intense at the moment. So be patient with your clinic. You may not get appointments immediately, and treat the staff there with kindness, patience, and respect, and you will get what you need.
Amen to that. So Massimo, can I come back to you? We had a question from a service user. I remember your role before COVID. You were doing outreach, and you worked in some really hard to reach clients, like on cruising grounds and so on. We had a question from on Facebook. Is it better to meet a hookup in an outdoor cruising ground rather than have them around to your house?
Well, COVID is the main thing about COVID, in my understanding, is that the close contact is the problem. So, I mean, the recommendations say that if you are in an open space, the risk of COVID transmission, if you're respecting social distancing, is less. But we also have to keep into account that when you meet for cruising in an outdoor place, you're still being in proximity, and you're not likely to observe social distancing. So I don't think there is much of a difference between having sex outside or having sex inside on COVID grounds.
I mean, I think that one of the complications that we've got here is that thing between being outside in a well-ventilated space, meeting up with groups and people, proximity to an individual, and all the rest of it. And I think that given that we are now working with the virus, which is much more virulent, which is much more easily transmitted, that those issues around close proximity, they're ramped up. So the information that we put out in the first and second lockdown was it's safer to have a hookup outside than it is in a closed space. But I think that Massimo is correct. It's less about where you are doing it and about who you are doing it with. So going back to what we were saying earlier on, let's try to avoid the hookups if we can. But if we're going to, then yes, outside is probably better than within a closed space with somebody. But then again, you're in close proximity, you may be doing lots of things which may increase your risk.
Massimo,
Yes.
you mentioned the new system that you've got for doing STI testing Positive East, and some of the results get sent off for analysis to get them back. Has there been any delay in us getting sent these results due to the extra workload on the NHS?
Well, as we said before, we have to be a little bit more patient with our clinical services provided by the NHS. So we have had some cases where the 3 working days were a little bit delayed, like a couple of days, but they are usually quite good in respecting their times, and there can be the occasional delay, but usually within 1 week, the results are coming back.
Okay, great. Okay, well, I think we've got one last question from Mark. It's in reference to you're talking about safe sex practices during COVID. This comes from Facebook. It says, "Are kinky rubber guys with full gas masks the safest sex you can have in a hookup?"
I don't know about the safest, but it certainly sounds like some of the hottest. I think, you know, I mean, it's like we were saying earlier, you know, is there anything that we can do to reduce that risk? So yes, if somebody, so basically a gas mask and full rubber will probably be the equivalent to your NHS staff's PPE, right? So I'm guessing that it would really, really reduce the risk there of COVID transmission. So going back to what we said earlier about point number 5 about getting point number 4 about getting kinky and creative, maybe these are things that you want to bring in. When we were developing some comics recently, one of the guys in there was in full rubber mask and full gas mask and rubber, and was like, is this hot enough for you? So again, I think that people need to make sure they get the right information and they will make those decisions themselves. So again, get tested if you can, you know, avoid those contacts and reduce those contacts as well. But there's no harm in, if you are going to do that, introduce that into the bedroom. Yeah, sure.
Great. Guys, I think we're out of time. That's been a really fascinating presentation, and you've both made some really interesting points and given us some invaluable information. So I hope that those of you that are watching have got at least something useful out of today's presentation. If you've got any questions that you'd like to ask us beyond this, please feel for Mark or for Massimo, please send them to me and I'll make sure that they receive those. Just so you know, we've got loads of support out there for you at Positive East, and our series of online workshops, Stride, are running every fortnight. We've got loads of activities on, like mindfulness. If you want to access any of the What's On events or have a look and see what's happening, please feel free to have a look at our Positive East website or our Positive East Facebook page. Fellas, that was excellent. Look after yourselves, stay safe, and thanks very much, and we'll see you soon. Good night.
Thank you.